When you have to do even trivial surgery and worry starts to rise, help to relax is essential. This aid consists of conscious sedation, a medical procedure that is used precisely to give greater comfort to the patient during other healthcare procedures, such as instrumental investigations or surgical interventions. During this activity, various sedative drugs are used which reduce the state of excitement or anxiety of the subject and allow him to rest and welcome the activities to be carried out with better disposition. But who performs this procedure and how does it take place in detail? How does recovery take place and what are the possible complications? Let's explore them together. Hello everyone and welcome back to Med for Care. Today's topic will be conscious sedation. We were saying that conscious sedation is a medical activity that serves to help the subject accept a health procedure with greater serenity. Why conscious? It is defined as conscious because the patient's state of consciousness during the procedure is not abolished but is only partially reduced. Indeed, the subject does not sleep deeply, and his ability to respond to verbal commands and tactile stimuli remains virtually unchanged. The degree of sedation, given the same drugs, is not the same for all patients because it depends on the individual sensitivity of each patient to sedative agents. Thus, each patient responds differently to the administration of increasing doses of the drug. When is it used? Now let's see what are the circumstances in which conscious sedation is used. Conscious sedation allows for the establishment of an active collaboration during the operation between the doctor performing the procedure and the patient. For this reason, it is widely used in procedures that require the active collaboration of the subject. However, it can be associated with other anesthetic techniques, such as spinal and epidural anesthesia and peripheral nerve block. This type of sedation finds application above all in different types of surgical interventions, of a minor type or related to the limbs, of diagnostic maneuvers or operations of an invasive nature and in dentistry. For example, among the minor surgeries in which conscious sedation is used we find reconstructive cosmetic surgery operations, minor orthopedic operations or limb operations, tissue biopsies, application of electronic devices such as cardiac pacemakers. Conscious sedation is also used successfully when carrying out endoscopic maneuvers for exploratory or interventional purposes, for example during gastroscopy, bronchoscopy or colonoscopy. In the dental field, conscious sedation is indicated in case of anxiety and marked dental phobia, execution of prolonged dental procedures, such as the application of a dental implant or the removal of a caries with subsequent filling, presence of medical conditions aggravated by stress such as bronchial asthma and epilepsy, children over 1 year of age, patients with neurosis or psychosis. The visit before conscious sedation. Who can perform conscious sedation? All doctors experienced in the procedure, having received a specific training to do it and able to manage possible complications, can perform conscious sedation. Indeed, the difference between conscious and deep sedation is that deep sedation is a riskier procedure, which can only be performed by an anesthesiologist who is an expert in this type of procedure and in the management of the possible complications that may derive from it. Conscious sedation, on the other hand, maintains consciousness and therefore reflexes and is consequently applicable by other doctors. Specifically, the person who performs it is usually the dentist or the specialist doctor during the execution of endoscopic investigations. Regardless of the professional who performs conscious sedation, it is necessary to carry out a preliminary visit with an objective examination before carrying out the procedure. This in order to examine the patient's clinical history and detect the possible presence of contraindications to the procedure itself. Visit and physical examination are two essential phases for the correct preoperative evaluation of the patient because any problems may emerge from these investigations, such as coagulation deficits or the detection of vital parameters suggestive of pathologies, such as hypertension, which can modify the conduct of the procedure itself. Often the doctor requests some routine blood tests, possibly accompanied by a urine test. The most requested blood tests are typically complete blood count to control the correct amount of blood components, Non-specific indices of inflammation. ESR and PCR to verify that there is no ongoing inflammation or infection. Liver function panel, renal function panel, coagulation panel. The preoperative visit finally ends with the patient signing the informed consent form for conscious sedation. The execution of the procedure. It is suitable for the patient to undergo the surgery on a complete fast for at least 6 hours, with associated limitation of fluids in the previous 3 to 4 hours. The drug classes most commonly used in conscious sedation are benzodiazepines such as midazolam, diazepam, triazolam and leprazolam, sedative drugs such as barbiturates and halogenated anesthetic gases. The mode of administration of sedative agents can occur in 3 ways. By inhalation, intravenous or enteral. The inhalation technique involves the use of a mixture of gases, in addition to air, i.e., the inhalation of nitrous oxide and oxygen. The intravenous conscious sedation technique, which is the technique that offers the highest safety and reliability margins, generally involves the administration of a combination of drugs including benzodiazepines. In all cases of conscious intravenous sedation, the presence of instrumental monitoring devices of the subject's vital parameters and venous access must always be ensured. Finally, in the case of conscious oral sedation, a single drug is usually administered in drops at its maximum effective dose. However, in this case it is necessary to consider the time necessary for the gastrointestinal system to absorb the drug, and therefore the administration must be carried out well in advance of the procedure. Recovery and possible complications. Once the procedure is finished, the doctor must ensure the complete recovery of the patient, constantly monitoring his vital parameters. In some cases, a recovery room is specially set up, while in other cases the patient recovers directly in the room where the procedure took place. The patient must then be accompanied to his home by a family member or a friend, because some side effects can persist throughout the day. It is important that the patient is accompanied because sedation in any case involves the reduction of reflexes, and it is strictly forbidden to drive a car or operate dangerous machinery. It is a situation equivalent to driving drunk or under the influence of drugs. Let's see what are the side effects of conscious sedation. Transient alteration of sensitivity. Temporary reduction in the amount of oxygen in the blood. Muscle fatigue, feeling of widespread tiredness. Lowering of blood pressure. Benign arrhythmias, such as heart palpitations. Visual hallucinations. Normally these side effects last for the day of the procedure. If they persist, then it is advisable to contact the doctor for an evaluation. We are now at the end of today's video. We hope you enjoyed it. If you found it useful, please support us with a nice like and subscribe to the channel. See you soon on Med for Care.